Hello, my name is Brian Walker and I'll be discussing the lower extremity CTA runoff exam. So as the name suggests, a CTA runoff is an angiogram of the lower extremities, meaning contrast is used to look at the vessels of the legs. So vessels like the femoral artery or the femoral vein are well visualized, and even the smaller vessels of the lower legs can be visualized as well. This exam is primarily used to evaluate pathologies of the vessels, such as atherosclerosis. Here we have a normal CTA runoff exam on the left. As you can see, the vessels of the leg are filled with contrast throughout the leg. The vessels also have a consistently smooth appearance. In abnormal CTA, as seen on the right, the vessels can take on a rougher appearance. There can even be blockages that prevent the contrast from moving through the vessels to the rest of the legs. Next, I'll be introducing the patient. The patient we saw in this case was a 63-year-old male that was checked in to our emergency department as a walk-in. The patient was experiencing multiple symptoms. These symptoms include shooting pain originating from the right thigh and radiating down the right leg. There is no trauma that initiated this pain. There is also muscle weakness in the leg, so the patient had difficulty walking. And the patient's right foot was turning pale and was cool to the touch, which was indicating a lack of blood flow. The ER physician quickly ordered a CTA runoff of the patient's right leg. There are several reasons for the order. After reviewing the patient's medical history, it was revealed that the patient had a history of high blood pressure, smoking, and obesity. The patient also had a history of atherosclerosis, which led to the ER physician to suspect that the patient had an aneurysm. The patient's age also helped the ER physician suspect this pathology, as aneurysms are more common in older patients. There are multiple risks involved with a CTA runoff exam. There is, of course, the risk that comes with any radiation exposure and the potential effects associated with that. There's also a risk of an adverse contrast reaction, which is caused when a patient is allergic to contrast material. If this patient was allergic to contrast, we would pre-medicate the patient and closely monitor the patient throughout the exam. There's also a risk of contrast extravasation. With any IV exam, there's a chance that the contrast leaks into the surrounding tissues instead of through the intended vessels. Contrast can also be harmful to the kidneys because the contrast is filtered through the kidneys, so if the kidneys aren't functioning well enough to process the contrast, there could be adverse effects. The patient's medical history also showed a prior CTA chest exam several years ago for different symptoms. The report for the exam explained that the patient had atherosclerosis. This diagnosis of atherosclerosis increased the suspicion for a leg aneurysm. Patient preparation in this case involves changing the patient into a gown in order to prevent artifacts from clothing. We also needed to evaluate the patient's creatinine levels to determine kidney function. The patient had a normal level of creatinine, so we knew there would be no issues with the kidneys processing the contrast. We also had to wait some time before starting the exam because the patient had recently eaten dinner and recent eating can affect the exam. Once enough time had passed, we had the patient sign a consent form for the exam. A typical CTA runoff uses non-ionic contrast because it's cheaper and is less likely to cause an allergic reaction. This exam requires an IV, so we place the IV in the patient's left arm because the patient will be entering the gantry feet first, so the contrast injector would be on the patient's left side. This will keep the IV from stretching too far, so the contrast injection will not be interrupted. This protocol also calls for a multi-phase CTA exam. In our facility, age doesn't affect the protocol of multi-phase CT. Using multi-phase CT will allow for better visualization of a venous pathology at the cost of higher dose. A multi-phase CTA exam evaluates blood flow at different stages, so an area is scanned multiple times to evaluate how the contrast moves through the vessels. Looking at our image here, we can see that the image starts by looking at the brain with vessels full of contrast. Then, as the stages progress, the vessels begin to empty, and we can evaluate how well that contrast is moving through. While this picture is of a head, the same principle applies to the legs. Before the exam started, we determined that the patient had no contrast allergies. When the patient went through their first CTA chest exam, there were no issues with the contrast given. The patient also had no known drug allergies as well, so should the patient suddenly develop an adverse reaction, we wouldn't be restricted in what therapeutic drugs we could use. As stated before, using multi-phase CT yields a higher dose for the patient. This is because multi-phase CTA looks at the vessels at multiple phases of blood flow, with a delay of several seconds in between phases. Even with a higher dose, the CT technologist elected not to use shielding over the patient's chest. The results were quickly read by an on-site radiologist. The radiologist determined that the patient did have an aneurysm in their right femoral artery. The aneurysm was reported to be large, but it had not ruptured yet. The aneurysm was also large enough that surgery would be needed to treat it. So here's one way an aneurysm could look in a leg. In this case, the vessel has an outpouching and is being stretched and filled with contrast. There are multiple types of aneurysms, and a CTA runoff is effective at evaluating all of them. The radiologist did not recommend any additional imaging because there was no injury to the affected area. The aneurysm was also well visualized thanks to using the multi-phase protocol that allowed us to look at the size of the aneurysm through different stages of the venous blood flow. Following the results of the imaging, the patient was quickly admitted to the hospital, where a surgery would be scheduled. Interventional radiology would be used to treat the aneurysm with minimally invasive procedures. Here are some examples for what the patient could have as a treatment, depending on the type of aneurysm. On the left, a stent is led by a guide wire to the side of the aneurysm, and the stent prevents blood flow from reaching the aneurysm, preventing it from bursting. On the right, a coil is guided into the pouch of the aneurysm, and the coil is bunched up so that not as much blood can enter the site to cause the aneurysm to rupture. Throughout this process, I learned that a CTA runoff has a very similar function to a CTA chest. The locations are different, obviously, but you're looking for similar pathologies. I also learned more about multi-phase CT exams and how looking at blood flow through different stages is very useful, particularly when looking at aneurysms. Multi-phase exams do give the patient more dose, but the higher dose is worth the benefits of the exam because aneurysms can be fatal, so it's important to obtain the best images possible. I also learned that leg aneurysms can be fatal like any other aneurysm. In the past, I would always think of the brain or the heart when I think of aneurysms, when they can actually occur in any of the main vessels of the body, including the leg. Thank you for listening to my presentation. I really enjoyed learning about this exam and the pathologies involved.